Next up is Luis Suarez, the founder of Sanarai. This is an online platform that connects Latinx community to mental health professionals in Latin America. Luis, you can start to take yourself off of mute. They work on providing culturally sensitive Spanish language emotional support at accessible prices. Luis, you can take it away.
Thanks, Alessandro, and thanks for having us. Hola, mi gente. Mi nombre es Luis Suárez. Soy el fundador y CEO de Sanarai. I'm not going to continue the whole presentation in Spanish, but when it comes to my mental health sessions, I do prefer to have them in my native language. And it turns out this is really hard. So only 5% of mental health professionals in the US speak Spanish versus 13% of the population that speaks Spanish at home. Treatment rates for this community are way below the average. So in a context of a mental health crisis with booming demand for services and a shortage of mental health professionals, the problem is exacerbated for the Latino community, and these numbers make it 3 times as hard to have behavioral health services in Spanish. So I experienced this problem myself. I'm originally from Mexico City, came to the US to do my MBA, worked in management consulting for 3 years. And in 2020, I was looking for mental health services. I was struggling to find someone that I could speak Spanish with and that could fit my schedule. And that's when I realized about this issue and decided to start Sanarai by connecting folks that speak Spanish in the US to mental health professionals in Latin America to provide culturally sensitive Spanish language emotional support at accessible prices. And that's still the core of what we do. So services in Spanish not only are super hard to get, but if you can do mental health services in your native language, it's going to be beneficial. The cultural relevance provides a baseline of understanding when you start with your provider. And those initial matches are going to be the best predictors of A, better outcomes, B, that folks are going to stick around for the services. And lastly, given the geographical arbitrage that we work with, we're able to offer our services at very affordable rates. Right now, we're priced at $42 for a 50-minute session, 50, when working with one of our providers based in Mexico. So we become a very convenient and affordable alternative to get high-quality mental health services. Right now, we focus on subclinical population. So we are not diagnosing, not prescribing medicine, and services are paid out of pocket for the most part or through partner organizations. And we've had great feedback from both of those type of clients, and this has translated in better client experiences and great growth. So we've actually recently hit 600K in annual run rate. We were able to grow our revenue 7 times last year. And very proud that we've been able to scale this with a high bar for quality. So we have 90 NPS and virtually no churn on the provider side. In how we go to market, we have a dual approach. We go direct to consumer, where folks find us on our website, book their sessions there. Lots of them come from word of mouth. And on the B2B2C side of things, we work with Google as an enterprise customer, as well as community-based organizations that pay for our services and provide them to their stakeholders. We have a strong team that's business acumen, experience working across the US and Latin America, as well as experience building clinical models and designing clinical products. There's nothing out there quite like us, so we see competition from 2 archetypes. So you have your big mental health companies, US-based at this point, your BetterHelp, Talkspace, which are not meeting our client needs in terms of language affordability, and then are more of a copy-paste of a model that is working for someone else rather than a company built from the ground up with this client in mind. And then the Latin America-based startups, they are similarly in early stages, very focused on Latin America. And we believe that by starting in the US, building compliance, partnerships, relationships, and credibility, we're better off than trying to expand to Latin America later, or starting in the US and expanding to Latin America is better than trying to do it the other way around. The market is huge. Only in the US, more than 42 million people speak Spanish at home. That within itself is a $3 billion opportunity, and these services are transferable in terms of language, geography. So we estimate the total addressable market to be around $45 billion. And we're only getting started. We will become the largest Spanish-first culturally relevant care provider. So far, we've raised around $600K to build a very high-quality network of 40 providers across the US, Mexico, and Argentina. We've validated different acquisition channels through direct-to-consumer and B2B, and we've built an engaging brand that folks can trust their mental health with. In this next phase, we're focused on building an in-house tech team to continue iterating on our tech product and taking some of the frictions that our clients that are having out of our product, and then as well as bringing on mental health leadership to the company to continue building and iterating on that clinical model. Beyond, there's a ton of exciting things that we can do with AI, chatbots, and expanding to other areas of wellness for the Latino community. So we are fundraising. We are also looking for more partners, and we already have great partners in Google for Startups, California Healthcare Foundation, and One Mind. So I'll leave it there. Thank you so much for your time.
Thank you so much for your presentation, Luis. It's really fantastic to learn about the great innovative work that you're doing here to connect the dots in a really meaningful manner. Now, who I'm going to be presenting for the next judge for the Q&A is Vanetta Daniels, coming from KPMG. She's the Director for Health and Government Solutions. Vanetta, you can take it from here.
Good afternoon. I'm very interested and very excited about what I was hearing from the tool, and I had a couple of questions. You had mentioned that you are U.S. focused. Are you in specific geographic areas, meaning is your focus, in the LA or California area? And so what is your kind of strategy to go to other geographic areas where, they face similar challenges and kind of create those partnerships? Second question I had was, there's a huge gap in providing mental health care services in the maternal wellness space. And so wondering if you were also partnering with organizations, particularly like CBOs and federally qualified health centers that provide maternal wellness services to kind of, to underserved populations.
Yeah, thank you for your question. On that point about maternal wellness, we're actually yesterday we're in a group of companies that are Google for Startups alumni, and actually we were talking about doing some partnerships on that front, because we know it's a big need and we want to have a more comprehensive offering when we partner with FQHCs and health plans. So we're definitely in the works. Currently, we're not offering this, but definitely something that we have on our roadmap. And in terms of geography, when we go direct to consumer, we've seen more traction from the markets that you'd expect: California, Texas, Florida, New York, Illinois. Mm-hmm. But when partnering with community-based organizations, we've seen that the need is actually more acute in more rural areas. So there's a newer Spanish-speaking population, but not many Spanish-speaking resources. So when partnering with these community-based organizations, we have clients that are in places like North Carolina, Tennessee, or Pittsburgh.
Thank you so much for your answer. Thank you so much, Vanetta, for your question here. And next up is Dr. Omar Njie, a principal at AliCor. Thank you so much for joining us.
Thank you. And thanks so much for a great presentation, Luis. My question is, so two-sided marketplaces are difficult to build, right? And especially, when you bring in geographic complexities. So how are you, on the patient side, thinking about your LTV to CAC, or, lifetime value, customer acquisition costs? And then on the provider side, how are you ensuring quality of providers, especially in geographies in which, you're not physically present, or, might have less information? There's maybe more asymmetry about the provider quality, especially if they're offshore?
Yeah, I can jump that on that first, Mark. Thanks for the question. This is Julio, COO of Sanarai. On the customer acquisition, we're currently we're improving month over month around that. Right now, our lifetime value by CAC ratio, it's around 2. We're targeting to get to 3 eventually in the next couple of months. And given our strategies and the optimization we will be doing in the direct to consumer side, we're confident that we're going to be able to continue improving this ratio. Definitely, we want to continue opening and developing our B2B channel, because that will allow us to bring acquired clients in a more efficient way. And our objective is to have a 50-50 split in our channels by 2025. Regarding the second part, part of our team is in Mexico. So we partner with psychologists there to ensure the quality of the people we recruit. All of the people we recruit have a master's degree, at least 5 years of experience, and more than 1,000 hours of clinical psychology experience. And some of them even have a PhD, for example, or 30 years of experience. So we partner with local psychologists and experts that help us throughout the recruiting process. And we currently do that in Mexico and Argentina. Plus, Laura, which is our psychology advisor, is very involved in this process too. I don't know if that answers your question.
Yep. Thank you so much.
Sure.
Thank you so much for your question. And thank you so much, Sanarai, for the great work you're doing. And thank you for this presentation and Q&A.